just so callous. I couldn't agree with that, the way of describing it. But the background of having to actually make those decisions, you can see what a horrible job it was, really.
John Edmunds, the Professor of Infectious Disease Modelling at the London School of Hygiene and Tropical Medicine. He was a prominent member of SAGE, the group of scientists advising the government during COVID. Good morning, John.
Hi there.
Now, we've heard a lot of back and forth already during this COVID inquiry, pretty much as we heard there, about whose representations are most accurate. You were there at the time. Is Dominic Cummings right about how things were?
Well, I wasn't at central government. We didn't have any or very little contact with government ministers, so that was all done by Patrick and Chris, and they must have taken on an enormous task. It's quite clear.
Did you get the feeling at the time, though, that things were not going well inside government, that there was a sense that Boris Johnson was, as Dominic Cummings said, oscillating when it came to different decisions being made, and that there was a real frustration among Patrick Vallance and Chris Whitty about that state of affairs?
Well, not from Patrick and Chris. They were always very careful not to reveal what was happening within government. But just as a sort of informed outsider, you could see that there was delay in certain decisions being made at various times in the epidemic. And unfortunately, delay when you have something that's growing exponentially is really a problem. And so I think that dithering did cost a lot of lives, unfortunately.
When you say a lot of lives, is there a way to put a number on how many lives you think that may have cost?
It depended on the different waves. There's certainly many lives were lost in the first wave, just because I think it was inevitable. We had to go in. Nobody wanted to go into lockdown, but at the point where the NHS becomes so stretched that it may well stop being able to take patients on anymore, then that's something really drastic has to be done. And we reached that point on a couple of occasions, or 2 or 3 occasions. And at that point, you really do have to take drastic action. And the quicker you take that action, the better, of course. And so, yes, there were unfortunately people who died as a consequence of not taking the action as rapidly as it needed to be taken.
You say there, and I'm interested by it, that nobody wanted to go into lockdown. Is it fair to say that even among the scientific community, the argument about herd immunity was the initial approach to COVID-19?
It was a mitigation policy. I think it's wrong to call it a herd immunity policy. It's a mitigation policy. The consequence of that is, if you have one single wave, if you have eventually, then there will be a degree of immunity in the population, and so that will help slow or stop the epidemic in the future. The problem was, there was 2 problems, of course. To get there, enormous numbers of infections would have to happen, and that would result in a lot of hospitalizations and deaths. There's no other way, and so it was a horrible consequence. The other thing is, so there would have been ways of trying to manage that and trying to reduce that, and that really essentially meant dragging the epidemic. So the way to reduce it would be to drag the epidemic out for much, much longer than it was initially being talked about. It was assumption that this would all be over. I mean, I remember the Prime Minister saying, I think on the 18th or 19th, that we'd turn a corner in 18th or 19th of March, that we would turn a corner in 12 weeks. That would have been horrific. So the way to manage it was to really drag the epidemic out for as long as you possibly could, as low a level as you possibly could, and then that buys time for technical solutions. The most important being a vaccine. So you achieve herd immunity through vaccine, ideally.
I see. So when we see the former Prime Minister, talking about how the average age of people in hospital who were dying was actually higher already than the average life expectancy in the UK. And this argument about, well, maybe actually it's just what happens to older people. Lots of older people die with the flu every year. Maybe it's just nature's way. I mean, is there any validity to that argument?
It was a pretty brutal way of putting it, really callous. But of course, the politicians do have to weigh these public health measures against other things, economy and other aspects of society, our civil liberties and so on. So these are the kind of really, really difficult decisions that they have to make. I'm not trying to pretend that any of this was easy, because it absolutely wasn't. And those decisions are horrible, but they have to be made. I think, I mean, the way it was described, it sounded it was just so callous. I couldn't agree with that, the way of describing it. But the background of, having to actually make those decisions, you can see what a horrible job it was, really.
And is what you've just described there in that one answer really the root of part of this problem, which is that there was always going to be tension between the scientific community and politicians, because politicians have to think about everything in a much greater context, and perhaps even about what happens next with the economy. But when it comes to asking a scientist for advice, you are able to look at things, or you do look at things in a very different way. And actually, at the start of the pandemic, that did cause some tension. Do you think that was inevitable? And do you think we've been able to move on from that and understand the role of scientific advice and the role of politics in managing this kind of thing?
Well, I think that it was misrepresented, the role of the scientific advice, because it's only one small, or not small, but one component of this sort of advice flowing into government. So governments have to weigh up scientific impact, or the possible epidemiological and public health impact of a course of action versus the impact it would have on the economy, the impact it would have on people's lives and livelihoods. As well as just operational constraints. There are some things that perhaps we might have wanted to do, but we couldn't do just for all sorts of operational reasons. So, and so this sort of stuff, I think that, they were sort of hiding behind the scientists a bit at the beginning, in particular of the epidemic, saying that they were following the science. That was never true. There isn't one scientific view. I mean, we were always very uncertain about much of what was happening. So, and then on top of that, then of course they have to weigh these other things in. So I think really, I think that the public were misled a little bit about what the process actually is and who really makes the decisions. And of course, they are our government. That's why we elect them to make these, in this instance, really terrible decisions.
Was that intentional or unintentional, that misleading of the public?
You'd have to ask them.
John Edmunds, Professor of Infectious Disease Modelling at the London School of Hygiene and Tropical Medicine. Thank you for joining us this morning.
The point is, of course, that Dominic Cummings and Lee Canaan were not elected. But, Mike makes the point here that our excess death measure for the UK, we're kind of in line with other countries. And there is this slight feeling that whatever anyone did, COVID had its way more or less everywhere in a fairly similar fashion. And we stumbled, we've sworn a lot, we've got some things right, we've got some things wrong, we particularly screwed up care homes, which is a huge tragedy. But at the end of it all, when it's all washed through, we're almost the same as everywhere else, because in the end, COVID did what COVID did.
Do you know what I think? I think a lot of this comes down to people feeling like they didn't have the full transparency and the understanding of how and why decisions were made. And I think part of that actually is about reporting and the media and how we were able to cope with dealing with very detailed scientific papers and understanding exactly what John Edmunds was saying there. Science isn't one voice. The whole point of science is it's a balance and it's a concert of different voices. And I think initially, I think as journalists, I will say we did struggle. I think we did struggle. And I think what we've seen come out of it, some of the data journalism and the way we're seeing that applied to conflict now, some of the way that we verify and the way we report now has changed because of the pandemic for the better.